I felt that I was gonna die. Literally, I had woke up that morning and I was like, oh my God, I could die from this. I wanted to learn as much as I possibly could about whatever this was that was invading my body. I'm like, well, if I can learn about it, I can at least try to get one step ahead. I was doing well. I was trying to get back on track to, my new normal. And along came a breast cancer diagnosis, and this was out of nowhere.
The transplant. What was that experience like, and how was the recovery?
It was a little scary at first. Um, and the reason it was scary at first, just gotten over, okay, yes, I'm going to be able to have the transplant. It was still scary because I was going into the unknown. I didn't know what to expect. They had told me, on this day you'll go in, you'll get the high dose melphalan, make sure you chew ice chips, and then you'll have a rest day, and then you'll get your stem cells back. Okay, what does all that mean? So when it actually came, it was like, okay, so this is what they were talking about. But I think one of the most trying times was just waiting, for that engraftment period, because they're like, oh, you're gonna probably day 5, you're gonna be feeling horrible. So, I'm looking like, okay, is it day 5 yet? Maybe I'll start to feel bad. So for me, the transplant process, a couple of weeks before, like I started taking, they give you the shots, those shots that stimulate the stem cells. I had to give those shots to myself in my stomach, and that was a process because I never had to give myself shots before. You want me to stick this needle? What? How do I even do that? I'm scared. Um, so I gave myself just shots, in preparation for that. Um, excuse me. I did that process was outpatient. So after 4 days of the shots, I went to the facility to harvest the stem cells. So they put this big catheter in your neck, which feels really, really weird, and it was very painful for me. Um, to do the apheresis and get the circulating stem cells, from the blood. And that process was a little scary because you don't know what to expect. You're laying in this bed and you're hooked up to this machine, and you see the blood going out of your body and, being flushed back in. That was a little scary. Um, but I was very fortunate. I got all the cells that I needed, in 2 days of collection. So I didn't have to, come back. And they told me it could take 4 days to collect all the cells. Was very fortunate, got them all in the first couple of days. Um, I didn't go for the transplant right away. I waited a couple of weeks. And it was just something going on with my schedule that I wasn't able to go, or I wasn't scheduled to go. Then along came the insurance issue there. So my cells were frozen for a couple of weeks, and then I came back to the facility, and had to reinsert that Hickman port. I had to get that inserted again. Very uncomfortable to go through that process, to have that, kind of hang in there. Um, I'm admitted to the hospital. I go in, they test for C. diff. Lo and behold, I'm positive for C. diff. So there's another component of things that you don't expect. And I'm like, what is C. diff? Never even heard of it before. So that means I've got to be isolated. In addition to, the transplant, I've got to be isolated and, other precautions that had to be taken there as well. Um, but I go in, I get the high dose melphalan. I remember it was a Wednesday evening. It was a long day. It was a very long day. Um, I get the high dose melphalan. I'm chewing on the ice chips. Don't forget the ice chips. You got to have the ice chips. Um, and then on Thursday, that was my rest day. And bright and early Friday morning, the nurse comes in, she checks all my vitals and she's like, this is it. This is the big day. And a couple hours later, the other nurse came in with this little bag of cells, and I'm like, this is the life sustaining things that I'm going to get back. At that time, my couple of members of my family had come up. My friends that had taken off work, to be there for me, they were there and supporting me and stuff. They kept a chart, to let me know, kind of like what was going on outside of the hospital there. Um, and yeah, I received my cells back. It was the Friday morning, 11:40. Celebrated my new birthday. Uh, and the rest is kind of like, you're just waiting to see what happens there. Didn't feel too bad the first couple of days. The third day, I could start to feel like, okay, something's going on. The fourth day is okay. On the fifth day, my head started to hurt. Every time I would run my fingers through my hair, it would just hurt tremendously. And I'm like, what the heck is going on? Little did I know that was the beginning of the hair, getting ready to fall out. Um, and that was tough. Even though I knew it was going to happen, uh, it was still tough when it did happen. And like clockwork, on day 5, I kind of bottomed out. All my numbers had bottomed out, and I was feeling horrible. Had the worst diarrhea that you can imagine, feeling bad. I felt that I was going to die. I had woke up that morning and I was like, oh my God, I could die from this. At that time I was alone. My visitors hadn't come in yet. And I was just sitting there like, I could die. If I get an infection, I could die. There's no way that I can fight it all. It was so serene because there was another patient that was undergoing a stem cell transplant, had been there a few days before I'd gotten there and had caught an infection and didn't make it. So that, just knowing that on top of everything else, I was like a basket case. But I had great doctors, great nurses, a great team of people that, took care of me and pulled me through it. They would come in every day and, check on me and do what they had to do and just said, hey, you got to keep positive. You will get through this. And I believe them because they do this every day. Why would I doubt them? In my instance, it was my faith that really pulled me through and knowing that, I'm going to get through this. I believe that I'm going to get through this. I'm trusting the process, as they say, just trust the process. I trusted the process, but I still want to just, you have to acknowledge those feelings that you have, because if you don't acknowledge them, they would just eat away at you and eat away at you. So acknowledge those feelings and, you know, tell somebody. I told my friend, I was like, I felt like I was going to die this morning. I really felt that, I didn't know what was going to happen, what could happen. And that was very helpful when I let that out, when I released that and said something.
So I'm just taking notes here
Okay.
for your story. I love that because what you're modeling is, you talked about mental health before, but in these moments, a big important part of that is acknowledging. It's the acknowledgement that you are feeling these things, that you're not in the best space, that we're not in the best space, that can be the most difficult step. So you were able to do that.
Yes. Yes. Yeah, I acknowledged. Like I said, it's one thing that I have learned through this process is you can't ignore your feelings because they are not going to go anywhere. They're going to be there. They want to be acknowledged. And when I acknowledged every thought that came, I'm like, okay, I'm scared. Okay, I might die. Okay. I think it was just getting it out there, and just releasing it, having that release was very helpful in my situation.
You acknowledged it. You figured out how to release by telling someone else, making sure you gave yourself that grace to be able to feel these things and share it, which I think will model it really well for other people. So thank you. Um, how long did you need to recover from the transplant?
So recovery was it was hard. It was really hard. I think the thing that surprised me most was just the overwhelming fatigue that I felt. Like I would get up, sit on the side of the bed and go, "Oh, I can't do this today," and lay back down for a little bit. But then realize, okay, you got to get up. You can't just lay here in the bed. That's not going to be helpful to you. So I managed to get up. Then it was like, okay, let's get to the shower. So I would manage to get a shower, but I get out of the shower and I have to lay back down again. And I'm like, what in the world is going on? I can't even hold my arm up without, so that went on for a pretty good while. I didn't have to worry about, cooking or cleaning or anything like that. My friends were very good with that, making sure that I was taken care of. So it was just for me just to take my time and get better. You know, I made myself get out, walk to the mailbox, walk around the block there just to get some exercise. And what I did find is when I did that, I did feel better, you know. But there were those times when it was 1, 2 in the afternoon and I felt I needed a nap. I listened to my body. So I tell anyone, listen to your body. Don't think that you have to get back to life. No, you have to heal. You have to listen to your body and you have to take the time that you need to get well, you know.
Again, thank you for highlighting that because I think it is hard for a lot of people to not want more and demand more of ourselves without realizing our bodies are hard at work. And the other thing I heard was again with the help, you knew beforehand when I'm recovering from this transplant, it's a lot my body's going through. I may need help in these different areas, cleaning, cooking, whatever meals, these kinds of things. And you did make sure and your friends helped make sure that you were taken care of, right?
Yes, yes, definitely. I mean, this is the time I always tell people, make your needs known because people don't know. They don't know what you need. They don't, I mean, they can speculate, oh, she's going through cancer, she may need this, or oh, she just got out of the hospital, she may need this, but don't make people guess, let what you need, let it be known. Because people want to help, they're willing to help, but a lot of times they just don't know what to do. So you got to tell them, you know?
Be vocal, speak up.
Yeah, yeah,
And
definitely.
and so following the transplant, did you know the plan of maintenance therapy was gonna happen after? Well, yeah.
Yeah, yeah. So we had talked a little bit about what was going to happen after the transplant, and what we had agreed on is I was going to do consolidation therapy. They were still that was very popular at the time. Some doctors were doing it, some doctors were no. So we had talked about doing consolidation for about 2 to 3 months. After the stem cell transplant.
Can you explain to people who don't understand what consolidation therapy is in
Yeah.
layman's terms, what that is?
Yeah, so consolidation therapy is just a continuation of the therapy that you were on before you went for the transplant. You just do it for a little bit longer. I was told to deepen the response, and that was my first time hearing that. Deepen the response. What is that all about? Um, but it's just to try and get rid of more of the disease burden. I always tell people, when you look at that iceberg, I'm sure we've all seen that myeloma iceberg. So consolidation therapy was to chip away at that iceberg a little bit more there. So we had talked about doing that for 2 to 3 cycles more, uh, and that eventually turned into a 12-month cycle. Now, I really didn't fully understand that at first because I'm like, well, we talked about 2 to 3 months. What are you talking about? But when they explained to me, how we want to deepen the response, that when I heard that, I'm like, oh, okay, I guess I can, kind of go through this a little bit longer, because in my mind, that's gonna give me a longer remission. That's gonna help me live longer. That's gonna help me, you know, live as much of as a normal life as I possibly can. So I kind of fought it at first, but when I saw the risk benefit of it, I was like, hey, why not?
And
Yeah.
then when the 12 months came up, what was the conversation with your doctor about how to move forward?
Yeah, so we had talked about what's next long before, that end of 12 months, because me, I don't want any surprises there. So we had talked about just doing um, Pomalyst maintenance, just going on a single regimen for maintenance. I did during that time that I was going through the consolidation therapy. I did do some MRD testing. Yeah, so MRD it stands for minimal residual disease. What it is the test to determine if they can detect any myeloma cells after you have the transplant, or after you have went through your induction therapy era. Like I said, it wasn't something that they did on a regular basis back at that time that they do now. Yeah, so MRD testing, it's a test that actually measures any disease that may be left after you went through the stem cell transplant or after you've had your induction therapy. And at the time, it wasn't very popular. So when I had that testing done, um, I was very happy to hear that I was MRD negative. And at that time, my my doctor and I, we had both talked about, okay, so after you finish this consolidation therapy, we're just going to put you on a single agent Pomalyst as maintenance. Um, and of course, my question was, well, if I'm MRD negative, you just said that I don't have any traces of, why should I take this? Why should I want to continue with the maintenance? Again, and they explained to me, the goal is to get rid of as much, at myeloma as possible, chip away at much of that iceberg as possible. So when I saw the benefits of it, I, made that, and it was ultimately up to me. If I didn't want to do maintenance, all I had to do was say, no, I don't want to do that. They would have been okay. The doctors would have been okay with that. That's one thing that I learned about shared decision making. You have to have a say in it, because it's ultimately, it's you, it's your body, it's your quality of life. So make sure that you have a say in what's going on. Don't just go along with it.
Talk to us about the maintenance therapy itself, and if you've had to deal with the side effects on the palm. And
Yeah. So once I completed the consolidation therapy, I went right into, maintenance therapy. I didn't have any problems with it to begin with, but eventually it did kind of weaken my immune system. I mean, to a greater magnitude, to where my counts were always low. It was like every month I was doing monthly blood work. I had to do that in order to get the Pomalyst there. But my counts were consistently low, to where I was having to get the Neupogen, the Neulasta shots to, kind of build my ANC up. And it was at that time my hemoglobin was still borderline. I was still often fatigued for the least little thing. I had a conversation with my doctor about that, and they were like, okay, maybe we can do a dose reduction. And we talked about that and what that meant and what it looked like. And I did a dose reduction. And that did help, improve my numbers to where I was, not as bad all the time. Um, but we talked about that, and what that would look like and how to go about that. So that helped tremendously. I stayed on that particular dose for probably a couple of years. And then the same thing started to happen. I was just experiencing bone marrow suppression. It was really bad. So we did another dose reduction. I told them what was going on, how I was feeling, how it wasn't improving. And you could see it in my blood work every month. It was the same thing. So we decided to do another dose reduction and found a happy spot, I should say, to where I'm comfortable. I can live freely, so to speak. I'm comfortable doing things without having that fear of, my counts are low, I can't do this. And this is before COVID and the mask. You having to go out in a mask, and it's like, I don't want to do this. You're having to not participate in events because you're afraid of, okay, well, if I get this least little thing, I'm going to be sick and down for days. So it relieved that. It made things better.
I appreciate you bringing that up. Shared treatment decision making is something that everybody's trying to move towards, right? Most people, from the paternalistic doctor knows best to making sure the patient's voice is heard. And part of this too is you had mentioned quality of life, right? That's a very personal decision for people. So anything else you want to say about the shared treatment decision making and the difference that's made for you as a patient?
So when I learned that, I mean, it's a game changer, particularly for patients who are accustomed to just going along with what the doctors say. And I know in the African American community, that's kind of like the norm. The doctor knows best, this, he knows more than you do about the disease. You need to follow, what you've been told. That's just instilled in a lot of us. But that's not the case. It doesn't have to be like that. And people need to understand that they have a very important role. They play a very important role in their treatment decisions. You don't have to just go with the flow. You don't have to follow what the doctor is saying blindly because, you don't think you can say anything. You can say something and you should, because it's your life. You have to live with the side effects. You have to live with, the treatment schedule and things of that nature. So you want to have as much say as possible in that.
Do you have any guidance for people on how to know what questions to ask in these moments? Since you've lived it before, what are some of the key questions they can ask at these different junctures?
Yeah. So it's different for everyone. I found what was very helpful to me was a lot of the advocacy agencies. I went to the IMF website to find out, okay, this is what you're going to need to know, and these are some questions. They have some cool tip cards and brochures and things of that nature. I utilized the MMRF. I went to their website, found out what was going on. Places like that are very good to provide information. At that time, the health tree was just coming up, so I was looking over there to see what I could find that was going to help me figure out what to ask at what point in the journey there. So, yeah.
So many different parts of how we're able to help people who have been historically underrepresented in healthcare and have lack of access. So let's talk about that. Um, I know that you're N of one, right? Like you don't represent every, Black woman in America's experience. But can you give some insight into what that experience has been like? I know you've spoken with other people, Black patients, on their experiences. Give us a little bit of insight into what those conversations are like. What is that experience? And then, of course, we'll talk about how we can do better.
Yeah, yeah. So, being a myeloma coach, I get to talk to myeloma patients many who have been newly diagnosed. Many have, they've been on the journey for a while. And I get to hear a lot of, what they've been through, or, how many times they had to go to the doctor to get a proper diagnosis. Now, I realize that I'm very fortunate. I went to my primary care. She knew the test to run, picked up on the, high protein, and sent me to see a hematologist. I know that is not always the case. People may have to go to the doctor 2 or 3 times before they even, are heard to say, hey, this is what's going on. I talk to many people who, when they do get to the doctor, they find out that they're in kidney failure. And it's like, what do you mean I'm in kidney failure? Why am I in kidney failure? So it's the shock on top of having the disease. It's the shock of how you are told that you have the disease. Those types of things that patients deal with. I was talking to this one lady, and she had went to the doctor, finally got the diagnosis, but they wanted her to wait to start treatment. They didn't want to start treatment right away. They wanted her to wait, and it's like, why would they want you to wait? That doesn't make sense, I see that that doesn't make sense, but as a patient who doesn't know, how things are supposed to work, that may seem normal. Um, but it's just various things that, you deal with. The delay in diagnosis, varying things that, you know, um, patients have to deal with when it comes to those health inequities.
And to be clear, so is it that, sometimes the providers are not, when they see a Black patient or a particular kind of patient, then they're not even offering the option. So they're saying their sort of implicit bias would be, oh, well, you don't want to, you wouldn't trust going through a transplant anyway. Or,
Yeah,
yeah, talk about
yeah.
that.
Yeah, it's, you wouldn't want a transplant, or maybe you don't have the support to bring you through a transplant. Or sometimes it's just not discussed simply because it's just not, it's just not one of those things that's talked about. And that's very unfortunate because of the bias. You're making that assumption that just because I live in a certain zip code that maybe I shouldn't do this, or I wouldn't want to do this, or I don't have the ability to do that. I think it's a lot of it is just access to care. We got to make sure that we're getting the patients to the right place at the right time. And I know, like I said, a lot of it is access to care, but we have to break down those barriers to access to care. We gotta, I say we, I'm not a doctor, but as a doctor, you have to talk to your patient and maybe find out where there is the hesitancy. Let's say you talk to someone about a stem cell transplant and then they decide they don't want to do it. Well, why? You have to find out why. Is it that they don't want to do it, or they have other things that's creating barriers to them not being able to do it? Childcare. If you have children, you can't just say, "Hey, I'm going to shut down for 2 weeks to be in the hospital, and then I've got 100 days of recoup time." Who's going to take care of things? How are things? Who's going to take care of the house and stuff like that? Particularly, if it's not a two-person home, you have to take that in consideration. Getting back and forth to the clinic, that requires the follow-up visits. All of those things need to be taken in consideration, and you can't make the assumption that someone just doesn't want to do it because they just don't want to do it. There may be underlying reasons that it's, causing them not to.
And financial toxicity. There's also a cultural aspect of this that is so not, I think we're learning more, and I think trying to address more, but for very good reasons. There's distrust, not just
Yeah.
mistrust, but there's things that have happened that have led to distrust of the medical institution. And of course, there's Tuskegee, there's Henrietta Lacks, there's like cultural nuances. So Valarie, can you share some of that with our audience?
Yeah, yeah. So when it comes to culture, there are so many things that vary from culture to culture. And a lot of time it's cultural beliefs that prevent people from moving forward with a certain treatment, not just a stem cell transplant, but certain treatments, whether it's the idea of receiving blood, in certain cultures, you just don't do that. Um, so I think it's those things have to be acknowledged, you have to understand someone's culture in order to understand why they would make certain decisions. Culture is a big influence on decision making in many instances.
What I'm hearing from you reaffirmed is number one, listen, and number two, acknowledge. People have experiences, and once they feel like at least the doctor's listening and acknowledging, there's a respect there. And then maybe we can have shared treatment decision making and people more involved
Yeah.
in their healthcare. And so I really appreciate that, Valarie. As we talk now about, well, is there anything else in terms of solutions? Like, I think those are some really tangible things, and providers are hopefully starting to realize more of this. Anything else that we can do collectively to make sure no one's left behind in healthcare?
I think if patients are heard or they feel that they are heard, that would change the whole dynamic of things. Because a lot of people, if they feel they're not heard, they're going to stop talking. It's not going to benefit them. So just the whole piece on listening and understanding, listening for understanding, and not just listening to say, "Well, I heard what they say. It still doesn't make sense to me." But it may not make sense to you, but it's still acknowledging, what the patient has said, what's been said.
Well, thank you so much for that. I know that we're really focused on the myeloma story here. I'd be remiss not to ask though. I mean, I know you've dealt with a lot even since that first diagnosis. In fact, you had a second diagnosis. If you could summarize, and I know this really deserves its own conversation, but if you could summarize, what
Yeah.
happened and how you were able to move forward. I mean, dealing with yet another diagnosis.
Yeah, so after I was doing well. I was trying to get back on track to, my new normal. Um and along came a breast cancer diagnosis. And this was out of nowhere. I was going for my regular yearly mammograms and um always was told, you have the dense breast and oh, just keep an eye out for things and we'll see you back next year. So at this particular time, I went for my mammogram and I got a call back, and they were like, "Oh, well, we want you to come back. We need to do an ultrasound." And I'm like, I didn't think anything of it because all the times I've been told I had the dense breast, and I'm like, "Oh, I'm gonna go back and they'll do ultrasound and tell me I'm good." And but that was not the case this time. When I went back, they did and they picked up something on the screening mammogram, which they pulled me back for a diagnostic mammogram and ultrasound. When they did the ultrasound, they did see a couple of things that were not on the previous year's ultrasound. So I was sent for a biopsy. I was scared. At that point, I'm like, I knew what biopsy meant. I knew when I heard that, I'm like, oh, they're looking for something. They don't just send you for a biopsy. So that came back, it was breast cancer. So here I am again, that whole gut kick, like, again, really? Where did this come from? What did I do to deserve this? Um, but I will say, having been on the myeloma journey and knowing a little bit more, it was a little easier to manage this. I'm not saying the treatment was easy. It wasn't. But just knowing the right questions to ask at the right time, um, I knew how to advocate for myself a lot better than I did, going into the multiple myeloma. Um, so that's been an added step to my journey. Uh, I like to say the myeloma prepared me for, the things that I went through with the breast cancer there.
How did you deal with, having a second cancer diagnosis on top of living with, the myeloma treatment at the same time?
Yeah. Yeah. So with the breast cancer diagnosis, I was terribly scared that, okay, I'm like, gonna have to get treatment for this breast cancer. Is that gonna trigger something in the myeloma? So that brought about this fear of, okay, am I safe to do this? But with the breast cancer diagnosis, this is very early stage. It was stage 1A. There was no lymph node involvement for me, but it was just the location of the tumors. That it did mean that I did have to have a mastectomy to have the breast removed. And that is a whole nother, um, I call it a whole nother beast because it's, I look at, the blood cancer, it was almost kind of like an invisible cancer because it was something that was going on within your body. With the breast cancer, it was a lot different. It was harder because, having to have your breast removed, um, that it was very difficult for me to accept that in the beginning because I was thinking that this is like, okay, this is just too much. I can't go through this. I just can't do this. It's just the thought of an amputation on the body. I was very fearful. I was still, even though I was prepared, as a patient, I was still very fearful because I didn't know what the treatment would bring. I didn't know how the side effects would be and things of that nature. So I again, I try to be positive about things and look for the silver lining, uh, in the cloud there. My breast cancer was triple negative breast cancer, so I kind of looked at it like, okay, it's triple negative. There's no pill that I can take. I can't take anything to suppress anything because that particular type of cancer didn't respond to any kind of therapies like that. So again, I was very fearful of, okay, what if, you know, I go through all this, I have this chemo and I have my breast removed. What if it's still there? What if it comes back because it's triple negative and you know, it's not as easy to treat. So I was told. Um, so I was dealing with a lot of fear in that instance as well, just like I was with the myeloma. Uh, but I think what helped me was I just I sit, I just sat there in the fear. I acknowledged that fear, and I was thinking, okay, you've gotten through myeloma. You can get through this too. It's very early stage. I was in a good position, if that makes sense. I don't ever in a good position with any cancer, but I was in a good position to where I wasn't too concerned of, and my doctor assured me early on that, we can take care of this. This will not take you out, Valerie. And that was very reassuring to hear him say that. My the oncologist said that, the surgeon said the very same thing, very supportive and kind of guiding me through that process there as well.
You have survived and thrived, honestly, with the two cancer diagnoses under your belt already. Yeah, what's your message to people out there who maybe aren't feeling as confident?
Yeah. So I say, hope, find something that's going to give you hope. For me, I found very early on, particularly with the myeloma, um, I got connected with others that were on the journey. So I always tell people, get connected with others that have been on the journey. I found hope. I was about 6 months into my diagnosis, and I met a 26-year survivor. And that just brought me so much joy because I was like, 26 years you lived? I can do that too. It's possible for me too. So that just meeting that individual gave me so much hope. Um, so I say, don't think you're alone in this. You're not alone. There's so many people that are dealing with a lot of the same things that you're dealing with. Reach out to those people, get connected. If it's whether it's through a support group or a group at your church, get connected. One thing that you don't want to do is shut yourself off from people. Don't shut yourself off because that's not going to do you any good. Find people along the journey with you. Um, get educated about your disease, whether it's myeloma, if it's breast cancer, any other kind of cancer. Find out about the disease, understand what it is. Don't just listen to what people tell you. And I'm not saying you have to be this research advocate, but just find out, about the disease. Um, I say knowledge is power. Everybody's like, knowledge is power. But when you get that knowledge, do something with it. Don't just sit on it. I think that's where we make the mistake a lot of times. We have all this knowledge and then we don't do anything with it there. But yeah, those are things that I said. Learn how to advocate for yourself. You know, you have a voice. Your voice deserves to be heard. So, use your voice. Find others on the journey. Connect with others. You're not alone. And educate yourself. Knowledge is power. Do something with that. And I look for the positive. I try to be positive about everything. It's a silver lining somewhere, and I look to find that silver lining.